hate to compare myself to Bill Clinton, but I had one of those little stint operations. And I went into the hospital. I was there for 32 hours. And I got the bill from the hospital, not from the doctors, and it was $67,000. So I filed it with Blue Cross, and then I got the statement from Blue Cross, and I had my share, and they paid their share. And the cost of that same hospital stay was $30,000. I can only interpret that to mean that there's a different price for an insurance company than there is for an individual. Could you talk to that a little bit and
There's
how it
contracts.
makes sense with an HSA if you have a different
Well, there's
price?
contracts. Now, I contract to provide health care to people with Aetna or Cigna or whatever. And they've agreed to pay me, commonly 125% of what Medicare pays, for instance, okay? And so I'll say, any patient who comes in with Aetna, I'm not going to take any more than 125% of that, okay? So when you get the bill, the explanation of benefits, even though I may bill $600 for you to show up in my office, I'm going to only collect what I contracted for, about $250 or whatever it was, okay? The hospitals are the same. They have contracts. They send out the bill, what they would like to collect, and then the insurance contract decides what it will pay. Now, there's some good things to that. That's group purchasing, which is why the association health plans are another good market-based thing. But when you get into health savings accounts, we really, in my opinion, don't need insurance for routine annual medical care. So when you go to your cardiologist and you say, doc, I've been having chest pain when I go out and I walk the neighborhood, you should be able to see that doc quickly and pay him out of your health savings account a negotiated price, $200 instead of $250. Or if you want the best guy with the most years of experience, maybe $300 instead of $250. And when you do that, the market will set a good price. When you see those unnaturally high bills, that's a result of a runaway, non-consumer directed market that creates hyperinflation in healthcare, which is what we have. It's the next bubble. It's one of the next bubbles for our economy. I don't think I've answered all of the points, but at least it gets some of the basic facts. Yes?
Does anybody pay that $63,000?
There are people who will attempt to collect that. I've seen, but it usually doesn't happen. Now, it's very easy if you've been overbilled or billed a rate that you don't want to pay. You say, I've got cash today, or I've got a payment plan and a 3-month commitment. Let's sign a letter. I'll give you $20,000 if you get off my back now. Then you go get off a credit card. Or I'll give you $5,000 a month for the next 6 months if you get off my back. Okay, you can negotiate that. The doctor's office especially, if I call a patient and I'm not getting paid, I need the cash. I need cash flow. If they're willing to pay me, we'll negotiate. We'll figure it out. And when you get smaller and smaller, individual doctor's office, you can negotiate those prices. You can do it up front. There's a clinic called Solantic, Rick Scott from Service for Patients' Rights. He puts their sandwich board prices up right up in that example. You walk in, so it'll be $130 to see the doctor. Okay, I can do that. All right? And then I'd love to see the Burger King right next to it, or whatever. The North Atlantic Clinic, $125 to see the doctor. But they're not a doctor. Oh, that's a non-doctor person. Okay? Yes, sir.
My understanding is the current Obamacare program is in excess of 2,000 pages. How much of that would be pork? Would you have a clue? That's non-related. Whether we agree with him or whether we don't, how much of that is non-related?
I've read through a great portion of that. I don't recall seeing a lot of bridges to nowhere and pork. Most of it is excessive government regulation on insurance companies and doctors and patients. I didn't see a lot of pork in it. There's plenty of pork. The pork will come. Let's tack it on at the end. Rubber stamp, here's our chance. Yes, ma'am.
A few years back, my husband had a brain tumor in the hospital, and he lived in Portland, Maine at the time, and we had to get across the shield. And even back then, he went to Boston, Mass General, to have the nuclear things put into his head, and we got a bill for $100,000. And when we had gone, I said to them, he's going to cross the Blue Shield, and they said, oh, we don't recognize from one state to another and cross the Blue Shield.
Yeah,
And
they're out of network.
we had to, right, so then we had to fight, we had an attorney and whatever, and eventually we didn't have to pay, but my concern is when you look at it, because now my daughter has MS, is when you look at this whole picture, you think, my God, they're not gonna get the medicines that they should have, they won't have the coverage. You won't be able to transport them to a different state. I mean,
Well, you're right, and see, that discussion about cost should occur at some calm point before the radiation seeds are implanted. All right, there should be something, and then you can say, well, we're gonna go to Boston, how about if we go down to Manhattan instead? What are they asking? Okay, let's go over to Albany instead. Okay, what are they asking? And as people compete in the routine market, not the catastrophic market, costs will generally go down, and there's good data supporting that. And I know there's concerns. A lot of us want the security of a big brother insurance company that's going to negotiate the best price and all that. A lot of us like that security, but when you have that security, as Benjamin Franklin said, you often give up your liberty. Okay? So if you want that blanket, if you want the HMO blanket, you're going to have to take some trade-offs, and those trade-offs are government committees deciding what they won't cover. Breast mammograms for age 50 and less in California. As soon as they came out with that, Medicaid said, we're not covering in California. Anything else? I know I'm getting into your meeting time. Yes.
Just a comment. My husband and I escaped the socialism of Massachusetts a while back, and very happy to be in Florida. But I just want to comment on the government taking your income tax refunds. We have friends and family who have called us to tell us they have taken their tax refund money because they did not have health care. So if you think they're just saying it, if you think it's just rhetoric, it is not. They're actually doing it now.
I think I've probably run out of time. I want to thank you very much. Keep funny.